In this video, we're going to explore the question of whether more credentials mean more money in medical coding. I know a lot of people are really interested in this topic, so I'm going to dive in and we're going to see what the data says, and then I'm going to give you my personal opinion of that. The first credential that I got in medical coding was my CPC, and then I got my CPMA. And the first thing that my colleagues started asking me is, hey, are you now making more money? Are you compensated more by your employer because you got that credential? And I'll tell you, I didn't, but it was a really good building block. I was able to put it on my resume, and that was something that helped me in my career to get a position from medical coder to senior medical coder to supervisor of professional fee coding. And then when I went into auditing, I didn't have to worry about obtaining that credential because I already had it. But of course, if you're just starting out and you don't have any credentials in medical coding, you still need to get trained. I want to tell you about Preppy, and you can find out a lot of what you need to know at my medical coding masterclass at medicalcodingmasterclass.com. The masterclass is free to sign up, and what it does is it gives you like that whole checklist. Like if I'm someone who's interested in medical billing and coding, I don't know anything about it, and I want to get a career and like be job ready in as little as 6 months, like what do I need to do? It just takes away all of that guesswork and just lays everything out for you, gives you all the information that you're probably already asking, like what is the salary expectations, what is the job outlook like just sign up for the free masterclass and it will give you everything you need to know. Again, I will link it in the description below. Let's talk medical coding credentials. So when you're looking for a certification in medical coding, you want to get one from AAPC or HEMA. They are like the Coke and Pepsi of the medical coding world. You might get distracted by other certifications. I know sometimes people will set up like specialty coding credentials for their businesses. I think the best way that you can tell if a credential is going to be valued by employers is take that name of that credential, if it's CPC or CCS or CPMA, and put that into a LinkedIn search, put it into an Indeed.com search. If nothing comes up, then there aren't jobs open where they're looking for those credentials. So I know if I go into Indeed.com and I type in CPC, it's going to give me tons and tons of jobs because there's lots of employers that are looking for people with that credential. But some other credentials out there, you might not get many search results at all. So really look for those certifications with AAPC and a HEMA. Now, one of the first things people ask is, hey, if I'm certified with AAPC, should I also get certified with a HEMA or vice versa? The great thing about AAPC is they have a lot of different core credentials and specialty credentials, which we'll also talk about. But if you want to get, say, certified in risk adjustment, AAPC has a certification for that. A HEMA doesn't. So if you have your, say, CCS with a HEMA and you want to get specialty certifications, you're pretty much going to have to get a credential through AAPC and get a membership with both. Now, the thing to think about if you want to have a membership with AAPC and a HEMA at the same time is that you're going to have to pay for 2 membership dues and you're going to have to get continuing education units for both of those organizations. So if you're maybe not necessarily looking at getting into inpatient coding right away, you just kind of want to learn inpatient coding, I think you would be fine with just getting a CIC with the AAPC, but if you want to actively work in health information management or in inpatient coding, you should probably get that CCS through a HEMA. But again, AAPC is really great if you want to get recognized for having expertise in a certain specialty or you want to learn like risk adjustment coding. HEMA doesn't have a certification, and I don't think they have one planned. I could be wrong, but I don't think they have one planned for risk adjustment where AAPC does. AAPC has kind of 2 sets of credentials. They have their core credentials and then they have their specialty credentials. The core credentials are more broad. They're things like certified professional fee coder, inpatient coder, risk adjustment coder, compliance, practice management, and then the specialties are more like medical specialties. So they're things like OBGYN or general surgery, even things like family practice. Now they don't have one for every specialty, and actually some of the specialties that they used to certify in, they kind of sunset because they weren't popular enough to warrant the cost of having to maintain all of the materials that they were producing and maintain all of the exams and so forth. Now, some people will get confused and they'll see the core credentials and the specialty credentials and they think they have to get a core credential before a specialty, and you actually don't. There is no requirement to get any of the certifications through AAPC in any kind of order. So you can go right for your specialty in family practice coding, or you could just get like your CPCO, which is your Certified Professional Compliance Officer certification. You don't have to get any one before the other. Really, honestly, the only requirement for any of the AAPC credentials is that you pay for your AAPC membership, you pay for your certification exam, and you pass the certification exam. Now, of course, you're probably not going to do very well if you don't have some level of training in that arena, but technically, as long as you pass the exam, you can get that certification and you don't have to get one before the other. Now, you may see some programs that are listed as AAPC approved or an AAPC approved education provider. And basically what that means is that they either passed their medical coding instructor examination or they're using the AAPC's official curriculum to teach for that credential. There is no official program that you have to go through for any of the credentials that the AAPC has, but there are some programs that use their quote-unquote official curriculum. Now, the most popular medical coding credential, and also the one employers look for the most, is the CPC. It's followed pretty closely by the CRC, which is the Certified Risk Adjustment Coder, which means you just code in ICD-10 CM. But the CPB, the Certified Professional Biller, is actually growing in some popularity as well. And that's because I think the AAPC is selling package deals now where you can buy your CPC and your CPB at the same time and train for them and take both those exams. Now, that's a lot of general information about the credentials themselves, but now let's look at the data. Let's talk salary information. A lot of you ask me, hey, Victoria, I got my CPC. I want to get another medical coding credential. What is the one that's going to pay me the most? So according to the AAPC salary survey, and side note about the salary survey is submitted by AAPC members. It's the best data that we have, but it's not really official. It's not like they pulled it from HR. It's just everyone self-reporting the information to the AAPC. Now, the highest paid credential that the AAPC has is the CPCO, which is the Certified Professional Compliance Officer. And that credential actually pays, on average, a little over $80,000 a year, according to the salary survey. But let's think about that for a second. Is compliance an entry-level job, meaning that you can train for it in a minimal amount of time? It's not. Oftentimes, people that are working in compliance departments in the capacity of a compliance officer are people who have higher level education, or they've been in healthcare for a long period of time, so now they're able to speak to all of those compliance aspects. So while it is possible to just train for and pass the exam, that's usually not the case for most people with the CPCO. So chances are likely that just passing this exam alone in and of itself is not necessarily going to mean you're suddenly going to get $80,000 a year. In fact, there's actually a lot of regional differences, which we can see on the salary survey as well. Billers and coders that are living in California, for example, are making a heck of a lot more than the billers and coders that are working in Arkansas because the cost of living in California is a lot higher. Now, if you're kind of curious about your specific area, the AAPC also has a salary calculator where you can put in years of experience, certain credentials, and your location, and it will give you some of their data, give you an approximation of what sort of salary you would expect in that area with that experience with those credentials. Now, of course, you may see some differences if you're, for example, living in Arkansas but working remotely for a company that is primarily located in California. You might be getting compensated more because their headquarters is in an area where there's a higher cost of living. It's definitely one of the cool perks of working from home. So is credential collecting in and of itself going to equate to higher pay? Now, there was data in the 2021 salary survey that demonstrated that coders that have multiple credentials do earn more money. They differentiated between coders that had one credential versus two versus three or more, and you could see there was a slight increase with each one. But it's important to consider that people that have multiple credentials have likely been in the industry for a longer period of time, and they're already positioned to pay for additional training for those certifications and additional exam fees for those certifications. So of course, the people who can pay for the training and the exam fees are already likely going to be making more money. And then when they have those additional credentials, that data is going to come through and say, yeah, they have more money. Well, they were maybe making a little bit more to begin with. Now, another fun thing that I love to look at, though, on these salary surveys is degrees. There is very bare minimum, virtually no difference between a medical coder who has no college versus a little bit of college versus a bachelor's degree. The only big leap we see in the data is when you have a master's degree, and that's because those are the people who are presumably working in more director or vice president type roles. I see a lot of people that say, hey, I want to go out, I want to get my bachelor's degree. But honestly, if you're still going to work in the capacity of a medical coder, you're not going to go into management, it's likely not going to make a difference in your salary. There are organizations that will maybe tier their coders, that they'll say we have a coder 1 is someone who has their CPC, a coder 2 maybe has multiple credentials and X amount of years of experience, or a coder 3. And of course, there's credentials like the CPMA that can position you better for an auditing position. But these employers are paying you based off of the job that you're doing. So if your job skills, if the value you're providing hasn't changed at all because you have a bachelor's degree now, you're still doing the same thing, they're not just going to give you more money in most cases just for the having of the degree. So how do we leverage having additional credentials? I think if you get the credential for the job that you're really looking for in the future, it's going to be a lot more beneficial when the day comes that you are applying for that job. So if you're looking to get into professional fee auditing in the future, you might want to consider getting your CPMA now so that you already have that accomplished when you go to apply for an auditing position. If you're not really sure yet, a good way to kind of get a feel for that credential and what that exam might entail is to purchase the study guide. Some people have been very successful training for certifications just by using the study guide. Oftentimes they give you not only the outline of what's going to be in the exam, but they give you some practice questions as well. So if you get that study guide, let's say you're going for your CRC, your Certified Risk Adjustment Coder, you get the study guide, you look over it and you're feeling like super completely lost, then you know that maybe either that's not the right certification for you, or that you're going to need to invest a little bit more into a more in-depth training program. You can buy all kinds of certification study guides at aapc.com. And then if you find out that you need more training, you can get it through the AAPC. I have training for the CRC and the CPMA. You can even try organizations like cco.us. They're great. Now, of course, if you're just being driven right now by money, there are other things you can do. You could consider getting a part-time job or even some part-time gig work, some contract work, even working for codehealth.com, codehealth.com, Code Health with a K. Or you could even just start looking around, seeing if there are jobs that pay more. Maybe you want to get something remote. Maybe you want to level up. You want to go from a coder 1 to a coder 2. Start getting things ready to find something that you can switch to that will pay you more. And if you want some more tips on how to find a job, you can check out this video right here. Otherwise, I will see you guys in the next video. And until then, just keep on coding on.